Good afternoon, everybody, and welcome to the third Disability and Aging Community Living Advisory Committee meeting of 2021. Just a couple of logistics reminders before we dive in. We're still meeting in the virtual space, so this meeting is available by smartphone, tablet, computer, or you can dial in on your telephone using the telephone number and meeting ID on your screen. Live captioning as well as American Sign Language is available. Our sign language interpreter, Jessie, should be on your screen, and you can enable closed captioning by selecting the live transcript icon on your Zoom toolbar. The recording, slides, and transcripts will be posted to the California Health and Human Services Community Living webpage. I think some of that content is available now, and surely the recording will follow. We are saving ample time for public comment. I think there are 3 public comment periods built into today's agenda. Attendees joining by webinar using the computer can use the Q&A function to ask a question or click the raise hand icon to join the queue, and we will unmute your line. If you're joining us by phone, you can press #9 on your dial pad to raise your hand, and I will announce the last 4 digits of your phone number and will unmute your line for comments. And at this time, I'm going to pass it off to Darcy to give us an update from the California Health and Human Services Agency.
Thanks, Maria, so much. I'm really excited to be here today and excited to introduce Secretary Mark Galley, who will be providing us with a welcome and opening statement. So Secretary Galley, I see that you are online. If you want to take yourself off mute and provide the opening, that'd be great.
Terrific. Thanks, Darcy, and thanks all. Great to see the faces that I can see on my screenshot, knowing that there's nearly 100 participants. Terrific to be with everybody. I have to say, time flies when you're working through a pandemic and you're implementing exciting budget plans and new programs and proposals. But I can't believe it's nearly been a year since we really celebrated the many, many months, years-long commitment to the master plan for aging with so many of you, and the reconfiguration of our work groups and this committee coming together. I mean, I think we have so much that has happened that is terrific, and we're moving into another phase where the excitement continues, not just on what lies ahead, but how we take the successes from the last year and 2 years and really memorialize them into impacts in people's lives. And I think today is another conversation around the importance of housing and the challenges that face seniors and people with disabilities that we really have made an amazing amount of investment in to really change the arc of the lives of the people we're trying to serve. I also just want to take a moment and thank all of you for bearing with the agency. We've had quite a few important changes that impact the work we're talking about today. First, I just want to take a moment of public thanks to Kim McCoy-Wade, who was such an inspiration and such a leader, and somebody who I feel very grateful to have had a chance to work arm in arm at agency with on issues around the master plan, but really around so many important areas that came up during the pandemic, and her moving into another role in state government, leading at the governor's office. I think it's tremendous what she has done and what we'll be able to do. And as many of you have heard me say, the minute Kim shared with me her intent and move to the governor's office, I quickly, it was almost a reflex. I said, Susan DeMorris, we need to call Susan. And we were able to nab Susan as the new California Department of Aging director, not just a few weeks. She's already rolling up her sleeve, taking the work that all of you did with Susan outside of state government, but in partnership with the state, and now leading the helm there. Other important changes since we've had a chance to be together. Will Lightbourne left, re-retired. We're grateful for his amazing work. And I had the privilege of helping get Michelle Boss there at DHCS, a tremendous leader, a knowledgeable state experienced person, but also somebody who has this amazing and deep passion and commitment to moving issues of equity forward. And I'm grateful for her leadership as it intersects with the work here. And then I would just want to take a moment and acknowledge that we lost some leadership in this committee because of Claire's move into Claire Ramsey. So Eric, you're on your own, I think, for at least a moment. But we have Claire Ramsey now at Social Services leading an important and meaningful portfolio. It is so fun to see people move roles, but take the same issues and passion to complete them. So I mention all of that because we have a lot of work to do. There's no doubt the tremendous opportunities that we've had and been blessed to sort of lead forward with as a group takes leaders that lead with the heart, lead with the mind, lead with the partnership that I know the leaders I just mentioned do a tremendous job on. So I'm really pleased with where we are and where we're heading. I know that we still are under the cloud of COVID, and I'll just take a minute and wrap up with some words on that. I think what has been one of the hardest parts of being front and center and leading this pandemic is you can see things coming, but because it doesn't sort of show so visibly, you know, it's hard to lead in that area of uncertainty. And I will tell you, as we move into the holidays, we are worried about what is going to happen with cases and with those parts of California that don't necessarily have high vaccine rates that I know many of you live and work in. And I just would say on a very personal level that California has tried to lead on boosters and vaccines, and we're asking people, especially in the communities I know you all work and live in, to get a booster and get protected in a way that allows us to move forward into the holiday weeks and months with some confidence. I often tell our team, we can't allow history to repeat itself. And I will tell you that we're worried that it can, that what we experienced last December and January, just to take a look across the globe and you see other countries with higher baseline vaccine rates facing really big challenges today. And so I just take a moment while we celebrate the achievements and the leadership opportunities we have, also remind us that the cloud of COVID is still above us. We got to pay attention, keep our guard up, and do what you can personally and your families and communities to make sure you walk into next week, which is a week of giving thanks and being grateful for all the blessings we have to set yourselves up to be as safe as you can be. I know that that's a message that I don't need to spend a lot of time on with this group, but I think it's important that we get it out in our communities. And if my message of welcome can be of anything, it's an invitation to help us make sure that we get that message across. I'm worried about older Californians. I'm worried about people with disabilities who maybe don't hear the message as loud and clear. This is for you. Get your booster now so we can have and experience that protection that really has benefited California for the past many months. So with that, Susan, sorry, Susan and Darcy, it went on a little longer than even I bet you had hoped, but it's a real opportunity to just thank folks and share that message. So Darcy, I'll turn it back to you.
Great, thank you so much, Secretary Galley. A lot of really important messages. So for those who I haven't met, my name is Darcy Delgado. I'm one of the new assistant secretaries working with CalHHS, and I was asked today just to provide a little bit of update and overview of some of the things that we've been working on at CalHHS and things especially that pertain to our community of older adults and our community of individuals with disabilities. And so just want to take a couple minutes to touch on issues related to implementation and workforce issues. As Dr. Galley mentioned a few minutes ago, there is a lot of work that is being done, and work that we need to be continuing over the next year or two. And so want to take a little bit of time to talk about some of the projects that our agency has been working on, really with the hope of engaging with all of you, those that are on the call who have lived experience, who are providers in the community. You give us the pulse of what is happening and what is needed. And so hopefully my goal of providing a bit of an overview is partially a reach out for you to become engaged with a lot of the projects that are being worked on. So as Dr. Galley mentioned, there's just a lot happening in terms of record investments, groundbreaking legislation, and it really is an unprecedented time for aging and for the disability community, because we really have our foot on the gas right now. There are so many things happening. And as many of you know, we are still waiting on that final approval for the Centers for Medicare and Medicaid Services on the HCBS spending plan, but we're already starting to scope out the work. And so at an agency level, our intent really is to move quickly and move forward once we are approved. And one of the most important kind of investment areas, while I know that the focus today in this meeting is on housing, one of the crises that we're trying to really face head on is investments in the direct care workforce, specifically in the areas of geriatrics. You know, I think that Secretary Galley shares the concern that we are just really worried about the statewide workforce crisis that we're in today, and it's only going to grow as these populations grow. And so we really are looking to remedy, to recruit staff, to train staff, figure out from a state level how we can incentivize and compensate this workforce so it really is, we're able to provide a living wage. And excited to work in collaboration with the Labor and Workforce Development Agent Secretary, Natalie Pelugia. Both she and Secretary Galley have been engaged in these conversations about how we can collaborate to really address this workforce need. So those discussions continue, and really excited to see where they go in the next six to 12 months. Finally, the last thing that I will touch on is the excitement with the passage of the Biden administration's $1.2 trillion Federal Infrastructure Act that happened this week. And also the potential for the federal Build Back Better bill. And so for those who haven't seen it in the news, it really is going to provide some amazing opportunities specific for California in some of the areas of health and human services, housing, transportation. I mean, these are issues that our community of individuals who have disabilities and also the aging community, these are key areas. And just really excited about how kind of the discussion today is going to help shape what we can do in terms of supportive services. We need those supportive services for housing, transportation, things like broadband and accessibility for folks. And so hopefully we can start to see how all of these ideas are intertwined, and how a lot of the conversations today will help us construct what we're going to be doing in the future. So we know that the January 10th proposed state budget, a lot of it is already in flight, but there really is a lot more that's unknown, and we are working on it on a daily basis as we speak. But I think that we can say fairly confidently that the Master Plan for Aging, the Alzheimer's Task Force, these reports are really helping us guide what our priorities need to be, what the strategies are for moving forward with these populations. And so again, thank you for participating in the conversation today. I know there are a number of folks from agency and from our departments who are on the call today. Really excited to hear what folks have to say and their experience in these areas to really help us pave the pathway for the upcoming years. Thanks so much. Susan, I think I will hand it over to you.
All right, thank you so much, Darcy, and thank you, Secretary Galley. I don't know if he's still with us, and hello, everybody. I'm so happy to join you today for my first meeting as CDA Director. And first order of business, I want to extend my thanks to Eric Harris, our returning co-chair who represents Disability Rights California, and a very warm welcome to Patty Prunyaber, who is a senior housing attorney with Justice and Aging. Patty joins us today for the first time as co-chair of DACLAC. We also have 4 new members joining us today. Paul Dunaway from Sonoma County Adult Services. Paul's bringing the county perspective, and he's filling Diana Boyer's seat from the County Welfare Directors Association of California. We're also joined by Sherry Burns, who will be filling Christina Mills' seat as a representative of the California Foundation for Independent Living Centers. Kelsey Castillo on behalf of the Assembly Speaker Anthony Rendon's office. Kelsey is filling the seat of Gail Gronert, who recently retired. And additionally, we're welcoming Michael Blecker, who brings a stakeholder voice for veterans to the committee. Michael is Executive Director of Swords to Plowshares. And the agency is grateful for past and present members' service and for your flexibility as we've been transitioning. I just have a few updates for the group. As Secretary Galley said, we're approaching the 1-year anniversary of the Master Plan for Aging launch in January, and we're very excited that Assemblymember Nazarian, as chair of the Assembly Aging and Long-Term Care Committee, will be marking the occasion with a legislative oversight hearing in January. So watch for more activities to be announced in early December to take us into the new year. We're also very excited that today marks the 3rd meeting of DACLAC, and the Impact Committee has now met twice. We have new members joining the Alzheimer's Advisory Committee at their December meeting next month. And you may or may not know that the Equity Work Group, as part of the Master Plan for Aging, continues to meet regularly, and they'll be meeting next on December 16th. Probably by the end of this week, we will be announcing the members of the Elder and Disability Justice Coordinating Council, and their first meeting will be January 28th. So for anyone who was afraid that this Master Plan for Aging would sit on a shelf, we heard that loud and clear. Rest assured that these 5 work groups represent about 150 voices who will be meeting regularly, yourselves included, to keep this work moving forward. So we're very grateful to all of the advocates, stakeholders, and subject matter experts who contribute to these advisory groups. And we continue to look for new and different ways to engage the public and other stakeholders who aren't part of these groups. And one of those ways is through our MPA local playbook. Over the last 6 months, we've participated in over 24 local age and disability friendly summits, including Orange, Santa Clara, and Ventura counties. Amanda Lawrence, who's on the webinar today, has been spearheading and leading that effort, and we really appreciate all of the local efforts, and we're open to still others. So if any of you wants to get something going in your county or region, just let us know, and you can always reach us at engage@aging.ca.gov, the email that we'll be sharing with you. And then the last piece I want to share is that California's master plan work is being featured at Advancing States National Conference in Baltimore next month, where we'll be modeling to other states how to effectively plan for aging and disability policies, programs, and investments. So that's it for announcements from me. I'm now eager to get to the heart of our work today and introduce you to our presenters for the first segment. We are so fortunate today to have an all-star lineup representing a variety of perspectives. So please join me in welcoming Undersecretary Melinda Grant, Claire Ramsey, and Patty, who's our co-chair and also will be presenting today. And I will turn it now over to Undersecretary Grant. Thank you for joining us.
Thank you so much, Director, and welcome aboard and congratulations, and looking forward to working with you. And it's just such a pleasure to be with all of you here today. This is a topic that's near and dear to my heart, primarily because it's real. It's real for a lot of reasons. I just was in the process. I think in my last meeting, I was talking about how my dad, who had became ill, and I was, kind of a primary caregiver for a while. We've been going through a lot of stages as we age in place together, and so it's something very special when the work that you do connects right back to the center of your home. So I am going to be sharing some remarks before this group, really about a lot of the different housing investments that we have going on here in the state, and more importantly, how it ties back to the Asian population and some of the things that our departments are doing. I did want to also just recognize two key members of our staff, Deputy Secretary Sasha Kurgan, who is our new Deputy Secretary of Housing, who will probably be joining us here shortly, as well as our new Deputy Secretary of Equity and Strategic Initiatives, Erica Gonzalez, who also will be joining and participating in these meetings going forward. Really appreciate a lot of the equity work that is going on, of course, within this committee, and I know that there's going to be some features coming up soon where we'll be happy to participate in. I guess at least I just wanted to I won't say shortly, but briefly kind of just touch on the uniqueness of our agency. Our agency, the Business, Consumer Services, and Housing Agency, which I serve as the undersecretary, and Lourdes Castro Ramirez serves as our secretary. We have kind of two sides of the agency. We have housing, which encompasses the Department of Real Estate, the Department of Housing and Community Development, and our California Housing Finance Agency. We also have the Department of Fair Employment and Housing. On the other side of our agency is a lot of our consumer-related agencies. So we have a lot of our departments that range everything from the California Horse Racing Board all the way down to the California Medical Board within our Department of Consumer Affairs, and a lot in between there. So we spend a lot of time in where you work and where you live. So today we're going to talk about the housing side of where you live. And I just really wanted to touch really on kind of four main themes here in today's presentation. And it really is about a lot of the short and long-term housing investments that we're doing to really address the vulnerable populations. One is we are making tremendous efforts to stabilize vulnerable households through the short-term emergency rental mortgage assistance. Hopefully many of you have heard about that. The long-term budgetary investments in housing production, including Home Key 2.0 and the Housing Accelerator Program. 3, enhanced focus on housing accountability coupled with incentives for pro-housing jurisdictions. And then 4, efforts to strengthen housing and health investments to prevent and end homelessness with the creation of the California Interagency Council on Homelessness. And shout out to Dr. Galley, who we are excited to be co-chairing with as part of the new Interagency Council gearing up for 2022. So loving the interagency collaboration, not only on the homeless side, but also as part of the master plan on aging. So I wanted to first kind of just kick off with, some of the efforts within our housing and stabilization is that since March, the state has been able to provide assistance to more than 100,000 households through our California Rent Relief Program. For those of you who are not as familiar with the program, but that is our housingiskey.com, which we have kind of kicked off since the pandemic to really kind of reach those who were not able to afford rent. Many communities of color have been disproportionately impacted by the pandemic, but we have also seen this impact on our aging population, many of which are on fixed incomes, as many of you may know, and at higher health risk during the pandemic. Of the over 300 applications the state program has received, over 25% of applicants are adults over the age of 50. Just putting a pin in that. From the last month, the state program has been able to assist over 5,000 households per week, equating to approximately $60 million in assistance. We expect this rate to continue to increase as we have doubled the administrative capacity for the program, which we believe will help us continue to speed up its distribution. I want to kind of move briefly into the long-term budgetary investments that I spoke of earlier. And part of this year's budget alone, which included, of course, historic investments to increase affordable housing production, support homeowners, and reduce and end homelessness in California. One important key factor I want to just kind of highlight that many of you may know as well, that nearly 1 in 5 of the people experiencing homelessness in our state are over the age of 55. We are also committed to increasing the supply of affordable housing, and well as just literally a few months ago, we just announced the Housing Accelerator Program. This program will finance the construction of over 6,000 units of affordable housing that are currently awaiting full financing, including many dedicated to senior housing. These projects have already been reviewed and awarded funds by HCD, that's our Housing Community Development Department, and will be shovel ready within 6 months. We believe this will greatly accelerate the production of the state's affordable housing stock. Moving on to HomeKey, another program that was built out of the pandemic. In 2020, our Department of Housing Community Development launched HomeKey, which is the state's response to addressing 2 concurrent emergencies caused by COVID-19 and homelessness. HomeKey was a remarkable proof of concept in its speed and cost and effectiveness by bringing 6,000 units of housing online in under 6 months. Just wanted to pause there for a moment. 51 jurisdictions from up and down the state were awarded HomeKey funding, resulting in 94 projects that brought those experiencing homelessness inside into safety from the pandemic. This year, we are back with HomeKey Round 2 to continue the work of addressing public health and homeless issues, with $2.7 billion available to bring even more units and homes online. The HomeKey Program 2 provides a significant investment to rapidly expanding housing for persons experiencing homelessness or at risk of homelessness, and who are thereby inherently impacted or at increased risk of medical conditions due to COVID-19. But today I want to focus on something tied more closely to this discussion. This is HomeKey's attention to accessibility. First, the HomeKey program makes clear that all applications and projects must adhere to the accessibility requirements that are in state law. There is a threshold item, and this is important because there have often been questions by housing practitioners about how many and what percentages and to what standard units should be accessible. HCD clarifies these requirements in the Notice of Funding Availability, also known as the NOFA, and in a technical assistance addendum to the NOFA. And we actually have that on the website if anyone would like access to. Aside from that threshold requirement, the HomeKey NOFA also adds points for projects that exceed the state and federal accessibility standards. This further incentivizes projects to provide additional units with features accessible to persons with mobility disabilities and additional units with features accessible to persons with hearing or vision disabilities. We're pleased to share this news about the HomeKey program because it's important that we continue to center the needs of persons with disabilities when we are making investments in housing. I want to kind of end, or at least kind of end on the note of the establishment a little bit more, the California Interagency Council on Homelessness, which I mentioned earlier. And just for stats is that the governor signed AB 1220, which establishes this Interagency Council on Homelessness. It designates the 2 secretaries that I mentioned before of our agency, then of course of Health and Human Services. He also signed AB 977, which will enable us to drive accountability, ensures more comprehensive and robust data collection on state-funded homelessness programs, and brings expertise of key stakeholders into our work. Lots of great information there. But I know that was a lot to unpack, but I will stop there for now. And of course, just wanted to thank everyone for all the work that you do and look forward to the partnership and collaboration going forward. And I'll toss it back to you, Director.
Thank you, Undersecretary Grant. We're actually going to transition to Claire. So Claire, I hope you're ready. We're going to add a spotlight to you.
Thanks, Maria. I'm excited to be here with you all today in my new role. Thank you, Dr. Galley. So as I think many of you know now, I am now at the Department of Social Services as the Chief Deputy Director for Disability Adults and Housing Integration. And with that job, I'll be overseeing 4 divisions: the Adult Programs Division, Community Care Licensing, Disability Determination Services, and the Housing and Homelessness Division. And so I'll be, as was mentioned, I'll be working on a lot of the same topics I was when I was at Justice and Aging, but now through the lens of the state. And I'm excited today to come and present to you on all the efforts Department of Social Services is making around housing. And I do want to highlight before I jump into my slides that our director, Kim Johnson, is also here with us today. So really excited to have us both here and hearing from all of you about what's what's going on and what more we can do. So first, I want to just give some overview to our housing and homelessness program and some context about where Department of Social Services sits within the broader housing and homelessness landscape. Our department and our branch's focus is on the programs that function at the intersection of housing and social services. So as we know that our social services programs are a key access point for individuals and families and older adults facing housing crises. So our goal is really to not only end homelessness in partnership with local communities, but to increase access to social services across the board. And to that end, last year, actually, our programs have served more than 100,000 people. So we're really proud of the way we've built up our work around housing in just over the last few years. In the most recent state budget, our department received just over $2 billion in housing funding for the next 2 years, which is a very significant expansion in our funding. And I'm excited to highlight that 1.49 billion of that are funds specifically focused on older adults and people with disabilities. So as you just heard, really historic investments that will allow us to expand our programs to new communities and for our existing programs to reach even more people who are facing homelessness or at risk of homelessness. I want to walk through our housing and homelessness programs, and then I have some slides that gives more specifics about the 4 that are really related to older adults and people with disabilities. So as you can see from this slide, we run 7 housing and homelessness programs. 4 are aimed at seniors and people with disabilities, and 3 are really aimed at children and families. And at the local level, the CDSS programs are administered by the county or by tribal departments and agencies of social services. So these local departments often partner with other local departments, homelessness, continuum of cares, and nonprofits and CBOs to carry out the work. So with that, I just want to say that, I'll go through those top 4 on the slide, the Housing and Disability Advocacy Program, the HomeSafe Program, Project Room Key, and the Community Care Expansion. But just want to also mention that we do run those 3 other family programs, which are the CalWorks Homeless Assistance Program, CalWorks Housing Support Program, and the Bringing Families Home Program, which is focused on foster youth. Next slide, please. I also want to provide a little context for the need for these programs. And again, I know I'm speaking with an audience who feels probably uniquely qualified to know about the need that exists out there. So I just want to use a few statistics to frame the need for the housing programs and why we specifically designed stuff to serve seniors and people with disabilities. So in 2020, over 100,000 individuals with disabilities and over 14,000 who are 65 and older access the homeless system in California. We know that the number of homeless older adults is expected to triple in the next decade, and that often those individuals will have complex care and unique housing needs. The need to uphold housing stability for seniors is also a key part of the California Master Plan for Aging. I know that document we're all extremely familiar with, and it really places housing for all ages and stages as its first goal, so that, that is how important it is. But we also know that there is a goal within the master plan to end homelessness for older adults. So we have both those charges to really improve access to housing and to end homelessness for older adults. So with that, we really know that we have to connect seniors and people with disability to appropriate housing supports and to services that fit their unique needs. We think our programs need to be flexible so that they can provide housing related financial support, such as potentially rental back pay, rental assistance, moving costs, and credit repairs. And also our programs that can offer case management to support participants in gaining housing stability and to coordinate various components of their service plan. Next slide, please. So first, want to go and talk about HDAP. So that's the Housing and Disability Advocacy Program. First, many of you may be familiar with this. This is a program that has existed for the last couple of years, and this program exists to assist people experiencing homelessness or who are at risk of homelessness, stabilize in housing while also advocating for disability benefits, including SSI. So this program not only has provided permanent housing for over 1,900 people, including many who were chronically homeless, but has also had a 78% success rate in approvals for SSI, which is well above the national average. So what we're really seeing is that we're really zoning in on the people who need help, but with our help are able to get onto SSI and get stably housed. In addition to the ongoing $25 million that was appropriated last year for HDAP, it also received an additional $300 million over the next 2 years. And with that additional money, the match requirements were waived for those additional one-time funds. So more access for more communities to utilize HDAP. Right now we have 46 counties and 2 tribal agencies participating, and we're really excited to welcome new grantees soon. And HDAP funding can be used to support outreach, connections to disability benefits advocacy, and housing-related case management. We also can offer assistance identifying and securing new housing, and can provide support such as housing stabilization services, rental assistance, rental back pay, security deposits, and moving assistance. And with the additional one-time funds, we're hoping existing grantees can really expand these services to reach more eligible participants. And we're hoping new counties and tribes will establish HDAP programs. I did just want to highlight that there was a new all-county welfare directors letter that went out on September 13th, notifying counties and tribal agencies of these additional funds, and that guidance is available online. So, you know, if you're interested, please feel free to look up that welfare director's letter. Next slide, please. Our next program is HomeSafe, and this provides homelessness assistance and prevention services for adult protective services clients or those in the process of an APS intake. So APS clients are older adults and dependent adults experiencing abuse, neglect, or who are unable to care for their own needs. In this last funding, in this last budget, the age limit for APS is also being lowered to 60. So that'll mean more people will have access to HomeSafe. HomeSafe itself received an additional one-time investment of $92.5 million, with a similar amount expected next fiscal years, and these funds are also match exempt. HomeSafe can offer participants case management to help them reaching housing stability, also have housing navigation to identify and secure new units, housing stabilization services, connections to longer term care when needed, and direct financial assistance such as rental assistance, rental back pay, or modifications to make the home accessible. Already the program has helped over 2,200 people in 25 counties, and we're hoping the expansion will see new counties and new tribal agency grantees come on board. So that's one of the hopes for that expanded money. And we're really thinking this program can provide key, much needed housing support to seniors who might be in crisis because of abuse, neglect. And there was a county welfare director's letter that went out on October 15th, explaining all the pieces about the grants and the expansion for HomeSafe. Next slide, please. So next project is Project Room Key, and this is this is a first of its kind program to provide non-congregate shelter for those experiencing homelessness in the face of the COVID-19 pandemic, and has housed over 42,000 individuals to date. So we're very proud of this program and all the people it has helped throughout the pandemic. And we're also excited that this has provided a model that's paved the way for the massively successful Project Home Key, which is being operated, as you heard, from Housing and Community Development. So that program actually purchases and refurbishes hotels, motels, and other structures to create housing. But Room Key continues to operate, and we were given an additional $150 million in one-time funding so that we can continue to provide those services as the pandemic continues. So those provide both the non-congregate shelter for people, but also wraparound support services and the help with so people can transition into permanent housing. And we were already able to award these funds, and that happened in mid-September. Next slide, please. And I'm almost done. We just have so much going on. And last one I want to highlight is our newest program, which is the Community Care Expansion Program, which is starting to ramp up. And people have been putting a ton of work into making a successful program. So we're calling that CCE. So the Community Care Expansion, or CCE, will fund acquisition, construction, or rehabilitation of adult and senior care facilities to support seniors and adults with disabilities who are at risk or who are homeless. We're really focusing on SSI and SSP recipients. And we've really seen that those numbers over the last several years have decreased significantly. And we're worried that those numbers will continue to decline. So really trying to see these residential settings as an important part of the housing continuum for seniors and people with disabilities, including individuals with behavioral health conditions who might not have alternative housing options to meet their level of care need, and who might become homeless if they don't have these settings available. To this end, we have $805 million invested to ramp up this program over the next few years. And we expect our request for applications to be released in early 2022. And we will be working sort of in coordination with Department of Healthcare Services around another infrastructure investment that they're doing around behavioral health. So if you do have more questions about that, we can link you to a listening session that was hosted on November 2nd to gather more information. And finally, last slide, just say that, you know, we recognize that these are really important investments, but they're not happening in a vacuum, and that there are many other investments happening in the umbrella of CalHHS, including CalAIM, the home and community-based services like the assisted living waiver expansion and the residential continuum pilots that are right now waiting for approval through the HCBS spending plan. And that, you know, that there are other homelessness and housing assistance prevention grants that are moving forward. So more to come from us. You'll be hearing about funding opportunities, and you know, we're really excited to get this all moving. So thank you for giving me the time today, and looking forward to the discussion.
Thank you so much, Claire. And I believe it's Patty now. And you're on mute, Patty. And before Patty gets started, we hope to open for public comment at 3 o'clock.
Thank you so much, Susan, and welcome to your new position. I'm excited to be working with you. I'm honored to be joining this important DACLAC committee and hearing much more from you all. There's a lot that's happening right now. You've heard quite a bit, and I just want to sort of take a small amount of time to focus on why this session on housing is so near and dear to my heart. I am the senior housing attorney at Justice and Aging. I work a lot on housing stability for older adults and people with disabilities, as well as trying to prevent and end homelessness. So we know that having affordable and accessible housing is key to being able to fulfill DACLAC's purpose of advancing community living, inclusion and integration across this state. And the question that always comes up is, how can we advance community living and the availability of home and community-based services if a person can't access a home where those services can be delivered? So we have a lot of good things happening in the housing arena right now. You've heard quite a bit about it. I think the question is, how do we continue to build on and strengthen those initiatives while also realizing there might be new things we need to start or gaps we need to fill. And as Secretary Gali said, we have a lot of work to do. I want to just very briefly see if I can share my slides, because I want to be able to provide you with a little bit of reminder that I'm sure you all know about, wait, just one moment. Okay. I'm frozen. All right, you're going to get the whole, thing, not exactly what I wanted. Okay, does everybody see a Justice and Aging slide in front of them? Great.
Yes.
So I think the most important thing is when we think about housing goals and strategies in the master plan for aging, is recognizing that the very first goal, for some reason, this is freezing my, I'm having a little trouble. The screen share is freezing my ability to move my slides.
Patty, I can screen share. I can screen share for you.
That'd be great. Thank you so much. I'm going to stop. This is a test. Okay, great. So, you know, the very first, I think you're on number 4. There we go. If you could go to the next slide. The very first goal, as you know, is all about housing for all stages and ages. And this is a bold goal. It would take a lot to make it happen. There are 11 initiatives within this goal that relate to increased housing production, increased accessibility, designing age-friendly housing, looking at ways to create below market rate housing, and so on. But the key to it is that it lays out a very ambitious set of initiatives. And I think we can keep asking, you know, how many of these are we moving forward on, and how do we push the rest of them forward? And then housing appears again in Goal 5. And Goal 5 is mostly about economic security and affording aging, but it also includes a very important goal of ending homelessness. If you could go to the next slide. Thank you. So what does it mean to have housing affordable for all? We want to know that older adults and people with disabilities have access to quality, affordable, and accessible housing. This is really the underpinning of being able to implement advancing community living. We want to make sure that we can help older adults and people with disabilities stay successfully housed. A lot of the programs that have been discussed are trying to make that happen, but we have a lot more to do when we talk about both the physical accessibility of housing and the need for modifications, but also the integration of services to make that possible. And then the final one of preventing and ending senior homelessness. And then to turn to the very last one of ending homelessness, we know that the number of people who are age 50 and above who are becoming homeless is the fastest age demographic in the growing homeless population, and that about half of those individuals became homeless for the first time after age 50. So we want to really understand what are the barriers to accessing housing programs and services for older adults who are unhoused or at imminent risk of being unhoused. And you'll hear more about some proposals later, but I just want to identify the 3 initiatives that are in the master plan for aging that we can really be zeroing in on as ways to address this problem. And I think the other thing is to keep in mind that our goal is to end homelessness and to think about what is it that our multiple agencies working together need to identify in the way of benchmarks and goals to make that happen. So the first initiative is to build on the success of HomeKey to further develop housing and to end or prevent homelessness. You've heard about some expansion of HomeKey, and we also know that sometimes there are difficulties for older people and people with disabilities in accessing HomeKey programs, perhaps because they need assistance with daily living activities, perhaps, as was mentioned, they may have disabilities that make it difficult to access these programs, and also because even though we've ramped up a terrific amount of new capacity, it's not enough to meet the need. Claire mentioned initiative number 118, all that CDS is doing around HomeSafe and the Housing and Disability Advocacy Program. And I think that we look forward to seeing how those results produce both more housing options and getting people to a more safe place. And then finally, the IHSS Plus housing models is a really great opportunity to look at how certain individuals might be able to live in the community if they had personal care brought in, and they might not be able to direct their own care, but it would still be an option for a certain number of people who would benefit from in-home supportive services, but perhaps it would be better for it to be site-based in an intensive model, such as permanent supportive housing or other models. So I am going to stop because my real goal here is to share with Eric Harris, my co-facilitator, an opportunity to hear from all of you and to make sure that the agency representatives can hear from you, the experts in the room. Thank you.
All right, so Eric is up. Thank you, Patty.
Thank you so much, Patty, and thank you, Susan. It's so great to have both of you joining on. I definitely will miss Kim and Claire and the meetings and discussions that we've had, but it's great to have both of you and still be working, of course, with Claire. And I know we'll have some time further down the line to work with Kim as well. So just as a reminder for everyone, my name is Eric Harris. I'm the Director of Public Policy at Disability Rights California and also one of the co-chairs for the DACLAC committee. And just for a visual description, I'm an African-American male with short black hair with a beard and mustache. I'm currently wearing glasses and a red polo shirt with a white undershirt. And I am working from home here in Sacramento. So we wanted to have a good stakeholder discussion and really get the community's input. It's really important for this community to not just, as we've talked about before, have presentations where we're telling you all some of the issues and some of the potential solutions, but that we hear directly from community members what you all are experiencing and what you all are hearing from leaders within the community throughout the state. So I think the easiest way to probably do this is just to have people either raise their hands, make comments in the chat if that is easy for them, or just once there's a break after a speaker, if you want to unmute yourself and speak. But I see that Marty Emoto has his hand up. So if Marty would like to go ahead.
Thanks, Eric, and thanks to everyone, and welcome Patty as the co-chair of the stakeholder side, and Marty Emoto, family member, California Disability Senior Community Action Network. And I really appreciate the way that this discussion has looked at housing across the different systems. And it's this, what I like about it, and I think we need to go further, is this looking at our people, our community in the whole person and their families. And that's so critical. So just want to underscore that as we move forward, we're looking at the whole person, because that is a pivot in the way that we normally think. We think in terms of how we work within our own systems that we're familiar with, and we got to shake each other to get out of that mindset. The other part is making sure that whatever we do, and this is going back to the guiding principles of the agency, which I think are really transforming if we actually implement it, is that everything we do is person-centered and there's outcomes tied to that. I do want to suggest, though, as one of the next steps that, and I think we talked about this at the previous meeting, that there's a work group that Susan and Eric and Patty, you can consider forming, that is looking directly at the issues of housing, that looks at the whole person, that crosses all the systems. I just wanted to score that my sister had developmental disabilities, mental health needs, and behavioral issues and physical disabilities, but she was a regional center consumer. But I know that a lot of policymakers and some advocates seem to think that the regional centers take care of people with developmental disabilities in terms of their housing needs, that somehow the threat of eviction or homelessness does not exist. And we just need to underscore and remind ourselves that is not true. And one of the things the work group can do is help define the need of housing insecurity, the threat of eviction, for all of our communities across all systems. And just going back to what Patty, what you said, is that housing is so fundamental. It is, everybody needs a home. And from there, you can bring in services. But if you don't have a home, none of that happens. And just remind also that we're not just looking at the person with disabilities, we're looking at the family. If the family, for instance, an early start, there's children and infants, and if they're under threat of eviction, then that's going to impact whatever early intervention steps that we take. So we got to look at everything. And also, lastly, the workforce. Because we talk about equity, most of the workforce are people of color, and also spread across California, and they are facing housing insecurities. And again, if we don't look at the housing security of the workforce, then we're going to miss the challenge of trying to make sure that our people are properly served. So thanks. And again, I think this is a great discussion.
Great. Thank you so much, Marty. Next, I see Sylvia's hand up.
Hi, this is Sylvia Ye from Friends of Children with Special Needs. We are located in Alameda County and Santa Clara County. And I want to, I'm very excited to see so many great projects going on that. However, I did not see Section 8 housing in the list. I feel like for our populations, Section 8 housing voucher is so important. However, the waiting list or the lottery, it just, probably by the time they get it, probably they're seniors already. And I did not see that in the system. And I really want to really emphasize that that's really important for people with disability. And also most of them are SSI and SSDI recipients on that. And I think I would like to see that in the system if that's possible. And secondly, I also want to address the needs of individuals with a lot of challenges, either behavior challenges or medical challenges, and yet they still looking for support living services. However, the DDS system, it's really hard to support those people with high needs on that, and I'm hope to see that as well. And lastly, I also want to echo what Marty just said, the workforce. The living cost is so high, and we all know the inflation right now is just outrageous to impact to everyone. Our staff have to have 2 or 3 jobs in order to keep living in the Bay Area and serving the most vulnerable populations. And I hope this can continue to be in the discussion on that. Thank you.
Thank you so much. And actually, Patty, I think, can address your comment about Section 8.
Sure, and those are really great points. And I think every time we start talking about housing and then we go to workforce and we go to the way in which the systems all have to work together, it's a good reminder that this committee can really help break down some of those silos. But for Section 8, there is a huge increase in the number of vouchers that were just awarded across the country and to California. California got, over 10,000 of these emergency housing vouchers, and finding landlords to take them, that's very hard. Finding ways to make sure that they are providing housing that's accessible for people who have a need for physical or sensory or motor accessibility. So I think we have some problems. And then of course we can look to the federal government and the Build Back Better Act and say that if that passed, we would see another about 300,000 individuals served with Section 8 vouchers across the country. And there would be some prioritizing of the very lowest income families, as well as people who are at imminent risk of homelessness or currently experiencing homelessness, and some other selected categories. So you're absolutely right. That's one of the key ways to provide housing, and we need to really work to make sure that it's available, meaningfully available. And I defer to someone else on the other aspects of your interesting set of dilemmas.
Thanks, Patty. The next hand up that we have is Kim Mills.
Thank you, Eric. Hi, my name is Kimberly Mills. My agency is called A Better Life Together. I am a provider with the San Diego Regional Center. And I'm just excited to hear all of the initiatives on housing. We provide supported living, independent living. And it's exciting to see what's coming in the future. But it's also frustrating because we have some immediate needs now and don't always know where to go. I'm talking in particular about a situation that I'm dealing with now of a single mom who was in our supported living program, still currently is, had thought she was going to move out of state with some family, moved there, decided it was not a good situation and came back and is essentially homeless. And so we've been working with the regional center on what resources are out there, because of course she gave up her apartment and all of that. And she is now living in a hotel. And the response when we were asking, my agency was trying to figure out what's out there. It's like you have to call 211 to see if there's a homeless shelter. She's not appropriate for a homeless shelter. And it's kind of like there's nothing out there. And so there has to be something out there. And so it's like, I'm writing copious notes about all the programs and want to make some calls and see, hey, is there, through CalWorks, is there something out there? Is there some other programs across with CDSS that we can we now tap into? And so being a part of this committee is awesome, because I can see where we can, after we've exhausted all resources through the regional center, we can now tap into these other resources that are out there that maybe we didn't know that much about. So I'm hoping to make some calls tomorrow and hopefully get some resources, because we have some critical needs now. And so, but I'm excited about all the programs that are coming in, the resources that providers like me will be able to tap into to support people who are in our supported living program.
Absolutely. Thank you so much. Next, we have Lisa Gonzalez with her hand up.
Hi there. Yes, hi, my name is Lisa Gonzalez. I'm the Senior Director of the Deaf Plus Adults in the adult community and the Advocacy Administrator for the Los Angeles area. And I've seen many deaf homeless people out in the community and in the Bay Area as well. And there are just so many problems in these areas. I've noticed they repeat again and again, and I just feel so easy, that's easily they're getting lost. You know, they apply for Section 8 and really they're not able to read a lot of the forms and applications that are required to sign up for these programs. And they're losing their Section 8 because they're Section 8 vouchers because they're not able to keep up with to be able to renew every year, every couple years. They receive letters, updates with new addresses and things like that. And they're missing out on the opportunity because they're not having access to that information. And not to mention the long queue, and there's a lot of language issues as well. And there's a lot of forms that need to be developed with access, with sign language interpreters, the videos instead of forms. Deaf people apply, and they will benefit so much more, with that access. There are agencies throughout California that provide that kind of service, those kind of support and services, and I feel like from the top we need to improve on language access needs. My second issue that I want to bring up is myself, even being deaf, I prefer to be around other deaf people. Like Marty mentioned, there's a holistic person-centered approach where the person can, approach to be around people like themselves. And it's a special, there's people who are deaf and disabled or other intellectual disabilities, but we can work together and, even identify housings with different regions that are specifically deaf friendly or deaf for like senior citizen and aging communities. That's very unfortunate that there's a lot of loneliness happening out there. And there's a lot of elderly deaf people who are deaf, and they're being placed in environments with no culture, no access to language day to day. And it would be nice to have that advocacy and improve that situation. And so identify homes that can provide throughout the state of California, who can help the community, the deaf community, to start referring to focused, targeted areas and regions. So thank you for listening. And I look forward to hearing what the other groups are doing and what they're all the activity and all the energy that's happening today. So thank you.
Yes, thank you so much, Lisa. And it is so crucial that we have individuals with lived experience, especially from the deaf community, but all disabilities represented on these calls and on other conversations, because as you stated, the deaf community is unique in that deaf people want to be around other deaf people to be able to communicate, have community conversations. And it is in some ways different than other disabilities. And it's important that when we're working on policy, whether it's housing or any other policy, education, that we take people's lived experience seriously, and that it's so important that you're here, that people like Sherry Fiorina are here so that we can take your experiences and implement them in the policies that we work on. So thank you.
Sure, thank you.
So next we have Nina.
So good afternoon, I'm Nina with ARP California. Really important presentations today. I learned a lot, or some of it just kind of solidified some of my previous understanding. I do want to ask an additional question. Right now, pretty much anywhere in the US, somebody making minimum wage can barely afford or not afford a one-bedroom apartment. I mean, I was shocked. I just sometimes play around. I look at Zillow, and even housing prices like in Bakersfield are going up. What kind of thinking or programs are we all looking at or thinking about to help individuals, like older individuals, say, who may have some mild disabilities or none at all, to be able to afford apartments, but they're not low income. They're not Section 8 low income. But what we consider to be low income, as we know, is a very outdated concept. The poverty level is very, very, very outdated. So I just want to know what's being done in that sphere in terms of really helping people who are middle class and can't afford to live in their communities either.
Claire or Patty, do you have a response?
I don't have an answer, but I have a response, Nina, which is that you're absolutely right. In California, we have the highest housing wage in the country, followed by Hawaii, Massachusetts, and New York. You would have to earn $39.03 an hour to cover the fair market rate rent of a 2-bedroom apartment in California across the state. And as we know, there are areas of California where it's much higher. And we know that for people with disabilities and seniors who are living on fixed incomes, that certainly the SSI rate, which is below the poverty level, isn't close to meeting what you would need to pay for rent. So I don't have an answer other than you're going to hear in a little bit about one of the policy recommendations, which is a targeted rental subsidy, which would target people who are very low income, 20% of the median income in your region, and are paying at least 60% of their income for rent. We know that once you hit 50%, you are severely rental cost burdened, and that means that you are just one emergency, unexpected bill away from being evicted. So it's a stopgap measure, but it's an important stopgap measure unless and until somebody can get that Section 8 voucher or some other form of affordable housing, whether it's project-based or voucher-based. So I don't know if that's a bit of a pathway that we see. And, you know, Claire mentioned both HomeSafe and HDAP, and they also provide that kind of emergency infusion of housing assistance, but they provide it to very targeted populations. They provide it to either somebody who's in the process of applying for SSI or somebody who is involved with or at risk of being involved with adult protective services because they're at risk of abuse or neglect. So this is your income is what makes you eligible, your income and being a certain age or with a disability. So I hope that that's a possible path that we could see pursuing.
And just to be clear, these are all programs ARP supports. We have submitted our letters and so forth. But again, as Marty noted, for so many people that aren't low income but are struggling, certainly wider pathways hopefully can be explored. Thank you. Thank you for that explanation.
Eric, I'm going to take note of the time here. I wonder if we might take a final question, open it up for public comment, and take a short break. And then we'll have public comment again after the next segment.
Yeah, I think that sounds great. So the final question from Sherry Burns. I see your hand up. Oh, you're on mute.
Hello?
We can hear you now.
You can, okay. I'm having a little technical difficulties here. Yeah, just in relation to the previous discussion with regards to both Section 8 vouchers and the influx that we'll thankfully be getting from the federal government in the coming months. And the idea of subsidies or incentives that perhaps we can take a look at that have been piloted through the HomeSafe program. I'm wondering if there's any thought as to how we can possibly work with some of the landlords to incentivize them to consider accepting Section 8 vouchers. This has consistently been a problem over the last number of years with folks that are blessed enough in order to receive a voucher, but they've had such difficulty finding a landlord to accept it. Some of them are just not familiar with the program, or they've had bad experiences, negative experiences in the past, or they are concerned about the loss of potential rent revenue because of the length of time it can take for their apartment to be approved and the whole process. And just wondering if that's something that we're also taking a look at as we're trying to expand some of these programs and make them more available to folks that are extremely low income. Thank you.
Eric, if you want, I could take a quick stab at that with an eye on the time. You know, that's a whole conversation that I'd love to have, and it's a big one. For these emergency housing vouchers that are being rolled out right now, there are some incentives that exist. The housing authority or the continuum of care, whoever is dispensing these emergency housing vouchers, has up to $3,000 that they can spend on landlord incentives. That could be guaranteeing a certain amount above the security deposit. That could be just a lump sum payment at the front end to compensate for the time it takes to get the subsidy, you know, the apartment approved and authorized and the money flowing. And it also can include some case management that comes with it to assure the landlord that there's somebody they can call if there's a problem. The other thing is, you know, California has passed a law, and it's difficult to enforce, but it is there, that says that you can't discriminate based on source of income. And that means that somebody who comes with a Section 8 voucher, as long as that voucher is enough to pay the full rent that's being advertised, and so that the fair market rent is what's being set. As long as the rent is sufficient, you can't, in theory, turn that person away. So, you know, we have to watch for workarounds that landlords are finding, such as saying, well, it's not that, it's your credit report or some other issue. But I think that that does provide an avenue to ask landlords to really participate in the Section 8 program in a more meaningful way. And I think the fact that these are long-term subsidies makes a huge difference. If you have a landlord who knows that once this person is in, they have an ongoing assurance of the rent, that is a pretty nice level of assurance that landlords get as well.
Thank you so much.
Great, thanks, Patty. And I will hand it off over to Susan. I know we're on a time check.
Thank you. Thank you very much for that. That was excellent. Thank you, Patty, Claire, Melinda, for presenting. I also wanted to acknowledge before we open up for public comment on this topic, to Marty's point about whole of government, whole person, and whole family, that we are joined by 6 directors on this call. So we have Joe Xavier, Kim Johnson, Vito, Vito, how do you pronounce your last name? Michelle Boss, Nancy Bargman, and Kim Johnson are all with us on this call. So thank you all for being here today and representing your departments. So we now will take, looking at the clock, we will take 7 minutes of public comment, which feels very, very short, but we will open it again to public comment before we close the meeting today. And Amanda, so we have instructions on the screen.
Yes, okay. So folks, if you are joining us by Zoom, please go ahead and enter your comment using the Q&A function, or you can you can raise your hand and press *9 when I call on you. So I'll start with Leah Eskenazi. We're going to go ahead and unmute your line, and you can share your comment. Let's see. Do we have Leah's line unmuted? Okay, well, we're waiting for Leah. How about we try Shella?
No, I'm sorry. No, I'm unmuted.
Hi, please comment.
Thank you so much. I'm Leah Eskenazi with Family Caregiver Alliance. I'm just filling in for Kathy Kelly, who wasn't able to attend today. And I wanted to just echo the comments by, first off, by Nina and by Marty about all of those folks who are sort of above the poverty line, the official poverty line, but still are living on a very low income. We're hearing a lot from family caregivers who are very worried about foreclosure right now. They either left work to care for somebody at the beginning of COVID, or they ended up being laid off. And now they're starting to think about what am I going to do? And they can't get back into the workforce from their perspective because they're caring for a family member or a friend. What's a little different for them is often the caregiver is under 60 and the person they're caring for is over 60. So it's a bit of a mixed group, and none of the programs quite serve them straight on. So I just want to make mention of that and hope it'll be part of the discussion to recognize that group as well. Thank you very much.
Thank you, Leah. Now we can go ahead and unmute Shella Komendumong's line, please. If you're, let's see. There we go.
Hi, this is Shella.
Hi, go ahead.
Can you hear me okay?
Yes, go ahead.
Okay, great. Well, my name is Shella Komendumong, and I am the mom of someone who has developmental disabilities. I'm also the executive director of a nonprofit agency in my community of Santa Barbara that focuses on affordable and accessible housing. We work with all sort of segments of the population, but my comments today are going to be directed specifically toward people with developmental disabilities. And I am I'm honored to be here with you guys. I attended the very first Olmsted meeting in the state of California that was headed up at the Technology Center, the state's Technology Center. Grantland Johnson was convening. And what I'm hearing today is head and shoulders above where I thought the state would be way back when. The evolution is amazing, and I'm so incredibly pleased. I was also pleased to hear that there were so many people a couple of minutes ago talking about people with developmental disabilities, children and families who have housing needs in the state of California. We're a little bit behind the curve of other populations that have received more attention and funding and organization and that kind of thing. I do serve on the Developmental Services Task Force, and I think that if there's a takeaway about what needs to happen with this population, it's two main things. The first thing is that the task force established, the Developmental Services Task Force established a sort of dedicated standalone housing work group to address the many issues. The people that have spoken here today have brought up everything from discrimination and access to vouchers and other kinds of rent subsidies, access to the state's existing programs, which were discussed earlier. And those can be addressed in the work group. So I'm hoping that, maybe someone from the department will make a commitment to that. I guess the other thing is that I think that at Department of Developmental Services, there needs to be a high level person, maybe a deputy position or something like that, that can coordinate and investigate the issues around the lack of affordable and accessible housing assistance for people with developmental disabilities. It wasn't but a year and a half ago that we even sort of got completely out of institutional, developmental centers and that kind of thing. So we're just really starting up with trying to get people squared away in community with their services and with their housing. And I have a lot more to say, but in the interest of time, I'll sign off now, maybe comment on other things a little bit later. And thank you guys so much.
Thank you, Shella. And I'll read a few of the comments that we've received in the Q&A before we move on for our break. So Claudia Guzman said, I'm loving this entire meeting. I'm so happy that you are listening. I've submitted to everyone about my family being disabled and being overwhelmed with the pandemic. My son's disabilities have been affected. My daughter coming home from the university, then going back, and still having my son staying home and one doing school from home, but denied so much. I have suggested a committee with one provider or team handling the entire family services. And I believe actually the other ones have been answered. So we can go ahead. Susan, if you'd like to lead us into break.
Yes, thank you. Thank you, Amanda, for jumping in there. We will take a break now until 3:40, 10-minute break, and we will see you all back here then. Thank you.
Just taking a break.
Eric and Patty, I will let the two of you pick up from here. And we'll try to, we'll pick up a little bit of time and maybe take until 4:20 when we can open it up again to public comment.
That sounds great.
Sounds
Thank
great.
you so much, Susan. So I think we have everybody back from the break. Next on our agenda, we have part 2, ending older adult homelessness. And we have a presentation with some folks, and Sharon Rapport, Megan Rose, Alexis Chettiar, and Ali Cannington.
Hi, everybody. I'm Sharon Rapport, and I'm with the Corporation for Supportive Housing. We did a few slides, and I don't know if those are in the presentation. Oh, perfect. Thank you. So again, good afternoon, everybody. I am part of a coalition of about 20 different organizations that came together thanks to some funding from the May and Stanley Smith Charitable Trust. We came together around the Master Plan for Aging's goal of ending homelessness among older adults. And we wanted to come up with a list of state recommendations for action to further that goal. The recommendations we came up with between March and July or August or so of this year are really not going to do the job of ending homelessness, but they are intended to make a huge dent in ending or solving homelessness among older adults, which is the fastest growing population of people experiencing homelessness. The recommendations we tried to put together are intended to allow older adults to either remain housed where they are or to access housing if they're homeless or living in an institutional setting. All of the recommendations are very much promoting integration into the community and independence. So living not in an institutional setting or licensed facility, but at home independently. And with me today, as you mentioned, are Alexis and Megan. And so they're going to run through the recommendations, and I'll turn it over to Alexis to start us off.
Hi, thanks to everyone for inviting us to speak today. So thrilled to be working with Corporation for Supportive Housing on this project. I'm going to be speaking briefly on some of the recommendations around clinical services and making those more accessible to individuals who are either at risk for homelessness or coming out of homelessness. One of the central barriers to having, especially elder individuals, reside long-term stably in the community is access to supportive services that they would need to do that. There are a number of programs intended to fill this niche, intended to serve individuals who have that level of need. But in practice, that can really be challenging to access for folks who either are unstably housed or coming out of homelessness. So the central focus of our recommendations in terms of supportive services is around use of the assisted living waiver, home and community-based alternatives waiver, and PACE to serve these particular populations. We made some recommendations in terms of programmatic changes that would allow them to be more successful in serving individuals coming out of homelessness, and have made some recommendations around rate structure that might incentivize organizations who provide these services to really reach out and engage more actively in serving people coming out of homelessness. So just at a very high level, we're suggesting that homelessness be a prioritizing category or criteria for people who apply for one of these programs. If there's a wait list, we would suggest that if somebody coming out of homelessness is prioritized, we're looking at ways that enrollment can be expedited. Oftentimes it's a practical barrier. If it takes a long time for somebody to become enrolled in a program and they're unstably housed, it can be difficult to connect them with services. So looking at ways that we can speed that process up. And then again, looking at recognizing homelessness as a component of the rate structure within these programs. It oftentimes does require a more intensive service set to really stabilize individuals coming out of homelessness, knowing that they're both medically and socially vulnerable. So I would say bigger picture, the focus here is really to promote integrated health and housing solutions so that we can stabilize people in their place of residence of choice, right? That people aren't forced into receiving care in an institutional setting if that's not where they prefer to reside. So with that, I will go ahead and turn it over to Megan to talk a little bit about the housing components of the recommendations that we're proposing.
Great, thank you, Alexis. Yeah, and I have to echo what Alexis said. You know, part of what we are doing is looking at these our HCBS waivers and PACE, and how can we as a state better align them with housing? We know that affordable housing is a really common independent living setting for people who are exiting homelessness, and so in some ways it can be very simple. For instance, the assisted living waiver. You know, affordable housing units are an applicable setting for the assisted living waiver, but we have not really seemed to figure out how to best utilize affordable housing and the assisted living waiver together. So if we could better align our housing priorities with our healthcare priorities, for instance, you know, identifying housing projects and housing funding before the housing gets built, because it's really hard once an affordable housing community is built to say, okay, we've already leased up all 100 units, but we're going to try and set aside 10 for the assisted living waiver. You know, it's hard to pull those units out once they've been occupied. So getting to those developments before the units are occupied to say, okay, let's set aside 10 units, 20 units for the assisted living waiver. And then also looking at how do we entice housers to want to set aside these units, because right now in the assisted living waiver, we're seeing the state requiring a lot of those participants, a lot of those slots to be occupied by people coming out of skilled nursing, out of a congregate care setting. So how do we entice housers to want to participate? And maybe that looks like, you know, looking at that ratio, maybe telling the housers that yes, 40% of these units can be occupied by people transitioning out of your units by your tenants. So basically, you know, just we're really looking at how to better align housing and healthcare in some pretty simple ways. So the other two recommendations really quickly, one I think the group will really be interested in is we are recommending a targeted rental subsidy program. So we know that housing in California is extremely expensive. I think the average market rate of a one-bedroom apartment is something like $1,600 a month. And when you're looking at someone that's, you know, maybe living on SSI at a little over $900 a month, we are going to see an increase in homelessness, especially among older adults, which we have been seeing. So we know that targeted rental assistance programs help, and they really do help keep people from falling into homelessness and help bring people out of homelessness. So our recommendation is to create a state grant program to community-based organizations to help households that have a member that is 50 years or older and at risk of homelessness or experiencing homelessness. And so I think, you know, listening to some of the conversation that was happening before this, it would help in a lot of those situations. You know, this could be a program that helps incentivize landlords to house low-income tenants, maybe Section 8 recipients. It could help provide support for families where maybe a caregiver has taken a leave of absence from work during COVID and is helping care for an older adult. So that is one of our big recommendations, is this targeted rental subsidy program. And then the other is to increase the SSP. And we understand that there are a lot of efforts statewide to do this. And so we're kind of evaluating those efforts now and how we can best support them. So thank you. I don't know if Sharon, you have anything to add to close us out?
No, thank you both very much. And just available for questions if people have a few questions that we can answer. Thank you for asking us to be here today. Yes, Sarah.
Yeah, just one thing I wanted, thank you for that great presentation. I wanted to just add one element to that. I'm thinking about an issue that, recommendation that came up a lot in the LTSS subcommittee of the Master Plan for Aging process, which is thinking about housing. Absolutely huge need. And I think everybody agrees that all these proposals are really strong. One thing that I think could be supplemented with it is kind of a fund that can be used to address emerging needs that people have in their home or as they're transitioning out of an institutional setting. Providing one-time needs like getting a microwave or a refrigerator if it broke, or a new heater. So that concept of kind of a community living fund, I know it was included in the first version of the Home and Community-Based Services spending plan, but I think it would be a great supplement to these sort of housing proposals for people who are at risk of institutionalization.
Thank you. Robert?
Okay, thank you. Good afternoon to everybody. My name is Robert Mylan Taylor, the consumer advocate of the California Health and Human Services Disability and Aging Community Living Advisory Committee, and also the disabled consumer representative of the Lake County IHSS Public Authority Advisory Committee and chairperson. And I agree with the previous speakers that there has to be an increase of SSP, also known as the supplemental security payments. We need to have them not only to definitely get the housing that we really need, like getting our rents paid and all that, but we also definitely need for our necessities. So please keep that fight to definitely get the increase of supplemental security payment. It's really needed for all of us.
Thank you so much. I mean, I think we all agree with you completely. We have seen some research recently from San Diego that if older adults just had $300 a month additional, that a lot of the older adults who have been falling into homelessness would be able to remain in their homes. And so the SSP could be a big help just to allow those older adults to remain stably housed. We do agree that that's a critical piece of this goal.
Okay, thank you so much.
Thank you. Any other questions that we can answer about our proposals? Janie?
This is Janie Whiteford from Santa Clara County. I'm the president of SICA, California IHSS Consumer Alliance. I just wanted to make piggyback on what Sarah said about incidental expenses that folks might have. I think it would be great if we would have funding for adaptations for folks, that when they go into these housing situations, that there's money available for ramps, for anything like that that's necessary. I know the same thing happens with Section 8 housing. A lot of times landlords do not want to spend the money on any of these issues. And if there was money there and we could convince the landlords that it's not going to trash their house, that this would be a huge help getting housing available for those that need adaptations. Thank you.
Alexis, the Home and Community-Based Alternatives Waiver Program does allow for a one-time $5,000 fund for people to pursue home modifications. So just as there's ramps or stair chairs or whatever else may be necessary, adjusting doorways. So we're hopeful that by improving access to that set of program services that we might be able to accomplish that piece as well, the home modifications piece. But it's really a good point. It is oftentimes a barrier for people.
So,
any other comments or questions? Well, again, thank you so much for inviting us to briefly run through our list of recommendations. We do have a document that includes the recommendations. We are working on putting a lot of details into these recommendations, and we hope to pursue them over the next year or so. So we look forward to having many more conversations with many of you on this call. Thank you.
Great. Thank you so much to all of you. Really appreciate your insights and recommendations.
Thank you.
So I believe next on our agenda, we have Allie Cannington and the Kelsey giving a presentation as well.
Yeah, thanks. Thanks so much, Eric. Hi, everyone. My name is Allie Cannington. Some of you are familiar. It's good to see your faces. And for those of you who are new, it's wonderful to meet you. I'll do a brief image description. I'm a white queer person wearing aviator glasses with a gray sweater and a collared shirt with some piercings on my nose and lip and a blurred background. And so I come to you as a disabled Californian living in Oakland, who is the manager of advocacy and organizing at an organization called the Kelsey. And on the first slide, you'll see that there is an image of, you can actually keep it on the first slide, image of what one of our future buildings will look like. And at the Kelsey, we pioneer disability forward housing solutions that open doors to more homes and opportunities for everyone. And before today I'm going to give you a little bit about our work at the Kelsey, and then what we think about is terms of some policy frameworks that we use to think about both state and federal interventions that will create more homes for everyone. But when I talk about disability forward housing, I want to define that for a moment. And for us at the Kelsey, that means to center on the perspectives of people with disabilities, particularly those who are multiply marginalized people with disabilities, and the recognition that designing spaces, policies, and programs for disability access and inclusion advance opportunities for everyone. And disability forward housing solutions recognize that disability is often an identity for folks, and that disability is valuable and is worthy of being visible, and create spaces where people of all identities are seen, welcomed, and supported. And we're really excited at the Kelsey to spearhead these housing solutions that advance inclusion and create access, not to solve or dilute disability, but to include and embrace it. And so we do this, you can go to the next slide, through our theory of change, which is there's an image on this slide that is a diagram showing that we are a dual mission organization. We both build communities on the ground, so we build affordable, accessible, and inclusive integrated housing for people with and without disabilities. And while we're doing that, we're changing systems and engaging in policy change work to create the market and policy conditions so that affordable, accessible, inclusive, integrated housing can become the norm. And we do this, again, through policy work, through building communities on the ground, and then by supporting an increase of leadership of people with disabilities in the housing field across finance, development, policy, advocacy, and as an organization that's co-led by people with and without disabilities, we understand that it is foremost critical that these solutions will not be created without having people with disabilities as co-leaders, co-creators of these solutions, and particularly those with disabilities who experience other forms of oppression. And so excited to share briefly about a little bit about our housing work on the ground, but then shifting more to changing systems. So you can go to the next slide. This slide has three images of renderings, which again is our housing isn't built yet, but they're of the future buildings. And we have 240 homes in our pipeline. We're really proud to be the first investment out of Google's Affordable Housing Fund, as well as having state, local, some partners on this call, and federal partners in the government and other entities that are supporting this work to become a reality. So we have the Kelsey Air Station in San Jose, which will be 115 homes, 30% of the units priced at $500 a month. And that will be coming into construction this year, hopefully. And then the Kelsey Civic Center, which is going to be in San Francisco, which again will be a mixed affordable, ranging from people who rely on SSI as their sole source of income, all the way up to moderate income, and everything in between. And then we also have our inclusive partner properties, where we're particularly modeling or practicing on the ground our inclusion concierge services, which is a part of our housing model that we are excited to be piloting as we speak. And so as we shift into what we talk about as these unfunded policy mandates, I want to also anchor in what we think about at the Kelsey as the triangle of community living. And I'm preaching to the choir, y'all know this, but we can't have community housing and support and services. They're all deeply connected, but it takes particularly distinct solutions to make all of these possible. And so we need housing that is accessible, affordable across a range of incomes, and meets personal preferences. We also need separate but linked supports and services, including medical services and home supports and therapies designed to meet individual needs. And then, of course, without both of those working in partnership, we also need community, which is about creating connections, having an active life in and outside of your home. And so as we think about the triangle of community living and what the Kelsey is really practicing on the ground with an array of incredible partners, we're realizing that there are unfunded policy mandates for housing and particularly for HCBS recipients that I'm excited to share with you all today. This is nothing new, but I'm hopeful that, and we found at the Kelsey, it's been really helpful to spearhead different policy interventions that we believe are necessary, both on the housing and services, to create, the housing. There's just such a high need, and we didn't even go into those statistics today, but you all know through your own lives and through the people that we represent. So what does home and community based services have to do with housing development? So if you want to go to the next slide, we have an array of tools that have already been set for us, including the statewide transition plan, the HCBS settings rule, and of course the Supreme Court decision of Olmstead, which protects our rights as disabled people regardless of age. So when I'm talking about people with disabilities today, I meant to say this from the beginning, but I'm also including people, older adults who also have disabilities, that we as people with disabilities have the protected right to live in our own homes and receive the services that we need in those homes in our communities of choice. And actually in the statewide transition plan for California, which has a deadline of 2023, there is an explicit call out of a need for investment in affordable housing. And these are all tools for us. You can go to the next slide. And despite having these policy mandates, the historically mainstream housing infrastructure hasn't necessarily considered the needs of people with disabilities, because historically the housing that people with disabilities majority had were covered in congregate state-run institutions, facilities, including a lot of different congregate and institutional settings. And so as a lot of those close down, we still see people with disabilities of all ages still being institutionalized today. But as a lot of them closed down, there was never the investment from the mainstream housing infrastructure to invest in the housing that disabled people have the right to have. And so you can go to the next slide. And so, how do we build housing? And I want to say also that, and I know there's going to be a lot of unfinished business today, but at the Kelsey, through a variety of different research and community organizing efforts, we really have identified that that the housing interventions that are needed when it comes to meeting the unmet needs of people with disabilities, it's really looking at people who are people with disabilities of adults and of any age, who are extremely low income and who need supportive services in order to thrive in their own homes and communities. And so, as I said, we have state and federal mandates that give us in writing that we need the investment in affordable housing. And you can go to the next slide. So I'm not going to read all of this to you now. It's in your deck, but this is a work in progress. But I really wanted to share with you all some of the short, medium, and long-term goals that we see at the Kelsey as critical to increasing the supply of affordable, accessible, integrated housing for people with disabilities. It starts with what's happening right now with the Build Back Better package and things that are happening at the state level, like the Supernova that is coming out of the Department of Housing and Community Development, and ensuring that any type of funding that is for affordable housing that comes into the state, the state has a responsibility to, through these policy mandates, through the need, to ensure that there's more units, more homes for people who use HCBS. And so how do we think about that at both the short, medium, and long term? And how do we align not just affordable housing programs, but things like our tax credit systems at the state and federal level to also incentivize developers to ensure that the housing that they're building is inclusive, affordable, and accessible to people with disabilities who need home and community-based services. So you can go to the next slide. I'm not sure what my time is. I'm probably almost over it, but I just wanted to share broadly some affordability goals that we think are critical. There needs to be an increased alignment across the Department of Housing and Community Development and the Department of Healthcare Services around the housing needs of people with disabilities who use HCBS. We also, there's something called the QAP, the Qualified Allocation Plan, that every state has to implement in order regarding tax credits. And there's all of these opportunities to support the explicit development of integrated housing for people with disabilities. And then we also need to increase federal subsidies for housing for people with disabilities, including increased investments like the 811 program, which we see an increase in Build Back Better. You can go to the next slide. Accessibility. So improve and expand accessibility requirements in affordable housing to meet cross-disability access needs, while also supporting project feasibility and overall cost. And this can start by the Department of Housing and Community Development adopting the tax credit allocation committee's increased accessibility requirements that were made possible by so many advocates on this call, and this is at the state level, and then also exploring ways to provide cost accommodations and/or funding incentives for projects to meet advanced accessibility goals. And then lastly, if you want to go to the next slide, people were talking about the need for those transition-related funds. We needed, of course, an increased investment in the HCBS infrastructure, including the specific line item, that's not the right word, but of housing related services to support people with disabilities who are accessing HCBS and who need to find and retain their housing, and then also funding ongoing resident services, inclusion supports, and other housing supports for people with disabilities who live in affordable housing. And lastly, I want to invite all of you. The Kelsey convenes a California Disability Inclusive Housing Working Group. I'm really grateful to some of you on the line who have joined us as a participating member. We meet every other month, and the goal is to build greater coherence and alignment across disability rights and affordable housing policy, and would love to have you all join us. We actually have our next meeting this Friday, but you can reach out to me anytime, and would love to see how the efforts that you all are doing at DACLAC, that we can all just be supporting each other's work and pulling on the levers that are necessary so that both, people with disabilities and older adults are protected, that from discrimination, that if they're living in housing, that they're able to stay in that housing that is of their choice, and that we also just straight up need more housing that is affordable, accessible, inclusive, and integrated. So excited to hopefully have this be just the beginning. And my contact information is on the next slide.
Well, thank you so much.
Thank you so much, Allie. We really appreciate your presentation. I know that we're going to get to a question and answer portion, but right now we're in the discussion portion. So if people have questions that they want to direct to either of the last two presentations, or on this topic kind of generally, where some of the experts can give their perspectives, I think this would be a great time to do so. And I know our time is limited, so if folks do have questions, please raise your hand or make a comment in the chat or question and answer. We have any questions? Gabriel?
Yeah, thank you very much for those presentations. Those were excellent. Someone said we're preaching to the choir with a lot of this stuff, and I agree. All of us were nodding, and we agree with a lot of these initiatives. I wonder how much work is being done at the city council and the board of supervisors level, at the counties, to kind of push some of these ideas to the broader population. We're trying to do that at the regional center level, and I'm wondering, Allie, is that part of your work to reach out to the community at large and try to advocate for people with disabilities?
Yeah, great question, Gabriel. I think so. There's critical decisions that can create more opportunities and more housing that is affordable, accessible, and integrated, inclusive for people with and without disabilities. And there's ways of engagement at all levels. And a lot of, for example, there are jurisdictions across the state right now that are engaged in their housing element process, and there's an explicit line item in explicit requirement that the housing element has to include a particular plan for housing for people with disabilities. And so that's just one of many examples. And I think at the Kelsey, we see that there is a gap in disabled leaders and older adults who are at the table in these affordable housing when these affordable housing decisions are made. And so really invite you to join us in kind of building out the field. And there are amazing tools already out there to support advocates on the ground at these different levels, whether it's super hyper local or they want to engage at their state or federal.
Thanks, Gabriel, and thanks, Ali, for answering that. Any other questions? I don't see any other hands raised right now. And if I'm missing anything in the chat, please let me know. All right, I think that's those are the questions for right now. And then I think Patty and Susan, you all are next on the agenda.
Yes, I think this is when we would open up for public comment. If anyone wanted to comment on the last two presentations and anything that they heard, or if somebody was shortchanged from the prior session. And we have on the screen, if you're joining by Zoom, a function to ask a question, or click the raise hand *9 on your dial pad.
Okay, I see Shella has another comment. If we could unmute Shella, please. Shella, are you able to speak?
Hey, hi. How you doing? So listen, I actually had a question from the presentation for the Coalition for Solutions to Homelessness Among Older Adults. And regarding the recommendations, use assisted living waiver, home and community-based alternatives waiver, and multipurpose senior services program to promote the integration of housing services. But I was wondering whether or not that would also target individuals on the developmental services waivers. Since, you know, I mean, I guess individuals over 50, since the people on those waivers, or at least on the big waiver, are, you know, deemed to be eligible for institutionalization without having received those services.
Alexis, do you want to talk about that? And I just want to say that these were solutions to the problem of older adult homelessness. We certainly recognize that that is not the only group experiencing homelessness, but maybe Ali, you could, I'm sorry, Alexis, you could talk about the ways in which the waivers would work.
Or if that would be included.
Can Alexis Cochair be unmuted?
I heard the question. I don't know the answer.
Okay, thank you. Maybe that could be followed up on at least.
Yeah, I think I don't see Alexis on the list anymore. If you would like to send those questions over to the Engage inbox, we can send them to the correct person who can receive.
I sent them to the Q&A since I don't have access to the chat.
Yes, that's fine. That's appropriate. Just feel free to email us at the Engage inbox with any questions.
Oh, right. Got it. Thank you.
Thank you so much, Shella. Let's see, is there any, do we have any hands raised? No. Okay. I can just read a couple of the comments we've received in the Q&A. Let's see. Let's see here. I want to find one. What are you doing to improve the California building code to ensure roll-in showers are required for new apartment construction and renovated apartments? Thank you, Connie. Let's see here. I need comments, please. Actually, that is it for public comment. Unless I'm missing something. And then we have another public comment session coming up soon.
Allie, I wonder if you could address not so much the state building code with regard to roll-in showers, but the work that you and many advocates and Disability Rights California did before the Tax Credit Allocation Committee, and how that will at least change physical accessibility minimum requirements for new construction.
Yeah, sure, Patty. Can you hear me?
Yes.
Okay, great. So for just so everyone knows, and I'm happy to share out links, but because of decades of advocacy, we got an increase of accessibility requirements for any housing, affordable housing that receives a particular type of tax credit, state tax credits, and it is an increase. Don't have this in front of me, but I believe it is it 10% of units needing to be. If someone wants to correct me, there's many folks on the line who probably know this. I don't have it in front of me, but there's like a 10 and 15% requirements of more units that will be constructed to be for mobility related disabilities, and then the other, which will be for sensory and vision related disabilities. And I will just say that at the Kelsey, we fill this unique role where we are advocating for an increase of accessibility across the board, and we also have the experience of on the ground figuring out all the financing for how this type of housing can really be built and on the ground. And we realize that, you know, as we continue to increase requirements, which even the increase of requirements, you know, at the state level now, and also at the federal level, in no way reflect the actual population that needs the units, but also how do we incentivize developers to go beyond the minimum requirements? How do we support developers to kind of dismantle a real like fear-based idea around increasing accessibility, and how it's actually, if you create more accessibility from the beginning, you're actually going to create a more thriving community for everyone who lives there, including people with disabilities and older adults who will, you know, want it, and all residents who want to age in place and whose needs will change. And so how do we both have both a carrot and sticks approach for accessibility, you know, increasing the standard of how we have accessible housing across our neighborhoods and communities.
And I'm putting in the chat, and I wouldn't have remembered it either, Allie, but I just looked at my notes that
Thank you.
that the Tax Credit Allocation Committee, based on really overwhelming testimony and support from people with lived experience, from stakeholders, they were going to actually reduce the amount, the minimum requirement for physical accessibility in units. And instead they increased it for low-income housing tax credit construction from 10 to 15%. for mobility disabilities for new construction and from 4 to 10% for sensory or communication disabilities. So that's
Thank you so much. And I will just also add that, you know, yes, the TCAC increases are a huge win, but we also want to make sure that other programs are creating the parallel changes in their requirements. So I mentioned in my presentation about this supernova, which is the main funding stream for affordable housing in California. And there are some concerns that we want to make sure are addressed around ensuring that any housing that's being built, whether or not they're receiving those specific tax credits, are following this new percentage of requirements and then going beyond. Thank you.
Thanks, Sally. And this, of course, aligns really well with the Master Plan for Aging goal of being allowed to age in place in affordable, accessible, age-friendly, dementia-friendly housing. So it's all sort of a way for, I think, as Ali said, for understanding disability as something that happens to people in different times in their lives also. And as people age, they are more likely to benefit from those accessibility standards that are being built into buildings, and so that they can age in place. So I'm not seeing any other questions or comments. Thank you, Ali, for that brilliant presentation. We really appreciate it. I think it inspired a lot of us to think more boldly about how we approach these problems and really advance community living in the best sense of the word. So now, I think that was the last, was that the last public comment here? Or is it now is the public comment, excuse me.
I can share one more public comment from the chat.
Thank you.
Yes, James Tragiari says, for the discussion on older adult homelessness, low-income homeowners are also at risk of housing loss and homelessness. Work around property tax deferment, education around loan scams, and stricter standards around foreclosure processes and procedures are some of the issues that should be explored. Thank you.
Thank you. That was a written comment?
Yes. And Michelle Rousey mentioned that housing is a really complex system for people with disabilities and seniors, that navigating it is very difficult. Without continued support, people lose out on needed services, continued long-term, not just one time. It needs to be given as a whole person, lifelong. And that concludes the public comments.
Thank you. Thank you for that. I see we have a raised hand from Sheila Commandemont. Do you want to unmute and we can hear your comment?
It's up from her previous question.
Oh, okay. Are there any other questions that people have? And I think we can, going once, going twice, going 3 times, we can then conclude the public comment. I'm sorry, there is one person who would like to make a comment. Sherry Farina.
Hi, everyone. Hello.
Hi there.
So I just wanted to make a comment related to housing issues or the housing topic, because often people talk about housing when deaf people become sick. the housing situation, there is no place for them to go unless they're being transitioned to the hospital and then aftercare with rehabilitation. So, and then to a nursing home. So I just want to make sure that you're aware that for the nursing home care specifically, that there are many that refuse to provide sign language interpreters. They absolutely refuse. So we have to use, they say, let's use a communication whiteboard. Well, that's not sufficient for a deaf person to communicate. And then a person who is deaf cannot express themselves in their native language. So many times, if the hospital sometimes will uses video remote interpreting, and that's not exactly ideal with a person who is very ill, trying to look at a computer screen. So there are various situations that go on like that. So communication is what's happening with the self, and the person who's supposed to be the expert is not providing that communication to the person that is requiring it. And they won't provide interpreters because they only think about the cost as opposed to the person's life. So basically what we're talking about is attitude barriers and accommodations barriers, right? For deaf people. So in all of those areas that we've been talking about. So trying to work together to find a way to overcome those barriers, because it is consistent and reoccurring over and over again. It's horrible what has been happening. So hopefully that we can find a way to address that at some point within our discussions. Thank you.
Thank you for that comment, and thank you for lifting up that sort of persistent and systemic problem. And I think what is also interesting is the way in which you are connecting it to housing, because communication is an important part of being able to obtain and maintain housing. And it's also, as you mentioned in the hospital setting, so important to getting the care that you need and having your wishes known. It sounds like you're not really, you understand that the law would provide for access to an interpreter, but that it's actually operationalizing that and changing attitudes that is the problem. Is that, have I understood you correctly?
Yeah, yes, that's correct. You have understood correctly, yes.
Okay, thank you. Thank you for that comment. Are there any other public comments at this time?
I think we can move on, Patty, and we have another public comment period at the end as well.
Great, okay. For some reason, my agenda has disappeared. So if you could call out the next item on the agenda, that would be great.
Sure. We now have joining us Debbie Toth with Choice in Aging. She's going to share some updates on transportation. Debbie, are you here?
I am here. Hello.
Great. Hi, Debbie.
Hi. Before I even launch, I just want to thank Sherry. This year has been a real deep learning experience for me about how we interact and how we do better with the deaf community, and deaf with a capital D. And thank you for elevating all of that. We have much learning to do in that area. So hi, everybody. I loved co-chair Eric's and then Allie's modeling, so I'm going to try it out. My name is Debbie Toth. I'm with Choice in Aging, and I'm joining you from my home office. So you see background that looks like I have a beautiful desk and lamp and printer, and really it's just a facade. This is like an exercise room and a stand-up table with a blanket on it. And I am sitting on my exercise ball. I have a red sweater on and mostly salty colored hair. It's dirty as well, and that's why it's up on top of my head in a bun. So the last time I presented to this group of amazing humans, I was expressing 20 years of pent-up frustration with the inaccessible transportation status quo, and the culminating moment being the entire body of work presented from the Master Plan Stakeholder Advisory Committee related to accessible transportation being completely gutted in the cabinet level work group process. It was the very ableism and ageism we've seen actualized daily in a process that was built to deconstruct these isms. But I believe this was the watershed moment, the moment where what seemed like a complete nail in the coffin became the poster child for change. We were able to use this story to illustrate locally how vital it is that we do better. In Contra Costa County, it appears our battle for funding is becoming a reality. We are using a local safety net sales tax measure to fund the implementation of a local accessible strategic plan for transportation. We're at the implementation task force stage with funding lined up. What? Something I never believed would happen, honestly. I don't know why I kept fighting, but I did, because I saw 3 decades of studies sitting on shelves. So this watershed moment also led us to working with the California Senior Legislature to create the legislation supporting the recommendations that were actually gutted. And blessedly, the CSL, the California Senior Legislature, selected this as a legislative priority. So the legislation is very straightforward. It proposes improving existing legislation that came about in 1979 that created something called Consolidated Transportation Services Agency. The purpose of a CTSA was to improve the quality of transportation services to older Californians and those with disabilities while achieving cost savings, lowering insurance premiums, fostering more cost-effective vehicle operations, and efficient use of various revenue streams. While this is a phenomenal concept, without a dedicated funding stream, there has been limited deployment of successful CTSAs. Those are Consolidated Transportation Services Agency. This new legislation that we're working on with the California Senior Legislature dedicates funding to CTSAs and updates the statute with current best practices. Think single point of entry, mobility management, volunteer drivers, demand response rides, same-day services, and the list goes on. That was just to get you a little bit excited so that you can see that things are finally moving, and better yet, you can be a part of shaping what accessible transit looks like for all. We would like to invite anyone who cares about accessible transportation, and it should be each and every one of you, to join us with a small work group and doing some activities that are very short in nature to help us get ready for the next meeting of DACLAC. So where, like what we saw today, with all the right people from all the right places to present and to hear about the housing needs and the lay of the land there, we want to create that same thing for transportation, and it's going to take more than this girl to do that. So we are looking for people who can represent or who are from rural areas, disability, aging, folks who drive adapted vehicles, paratransit riders, the whole continuum of transportation options. So it's a short-term commitment. It'll be 2 to 3 months or 2 to 3 meetings in December and January to prepare us for our DACLAC meeting where we're going to focus on transportation extravaganza. So are you in? Do you know someone who's in? If so, either raise your hand, put your name in the chat or in the Q&A. I'm sorry, I don't know all the proper mechanisms on this. And if you are not able to do that, you can email Amanda Lawrence. And Amanda Lawrence, I think she'll put it in the Q&A or the chat, but I think it is amanda.lawrence@aging.ca.gov. Am I wrong?
That sounds right.
Woo. All right. I got it all in 5 minutes or less. Woo woo.
So that was really great, Debbie, and it's really important that we get this transportation piece moving. And I think the link between housing and transportation hasn't really been mentioned, but when we talk about transit-oriented development, that's what we're talking about, and certainly having that as the link between housing, healthcare, recreation, amenities is so important. So do people, if anybody wants to put their name in the chat or the Q&A, we'll find it either way, to be part of this short-lived but very vibrant transportation committee that will then be presenting in 2 to 3 months. You can do that now. And if for some reason you miss that opportunity, you can, as Debbie said, email Amanda Lawrence, who will forward that to Debbie. So that's really great. I think before we open it up for comments, we have a short amount of time now for an open discussion by all committee members on emerging issues and opportunities in community living, with a focus on equity, housing, transportation, employment, emergency services, digital divide, behavioral health, or popcorn it and you name it. So this is a moment. We've got about 10 minutes, I would say, to open that up for topics, and then we'll take some public comment before we close. So open discussion. Are people getting tired?
I see Marty has his hand up.
Well, thank you. I'm not seeing hands, so thank you for the help there.
Well,
Marty?
Thank you. Eric always sees me. So thank you for that, Eric. And actually, I just want to do a shout out to all the people, you know, Pat, all of you for facilitating this. This is really a well done meeting and with really compelling topics, and you kept it moving. And also appreciate carrying on Kim McCoy-Wade's, you know, commitment to always allowing for and making sure we allow for public comment, because she was always great about doing that. So, you know, appreciate all that. Marty Yamamoto, CDCAN family member. I just want to underscore again the need for the ad hoc or temporary work group that will focus in on housing and how we can move forward on that. And maybe it's not an ad hoc group, because housing will always be an issue that will be with us. And the other thing is, as we're looking at housing, and I appreciate the comments that Sherry and others have made, because there's so many pieces that we need to think about, is that any solution that we come up with for housing, whether it was from my sister when she was alive or others, it's never going to be permanent, that particular solution. And so we have to think that way, because sometimes we think that we come up with a solution for housing for an individual, and we think that, okay, they're done, but they're done maybe for a couple of months or a couple of years. And then we have to then look at other solutions. And then we got to look at the population coming up behind, you know, the people that we're currently serving. And then, you know, what are their needs and, you know, and all that. Lastly, to follow up on what Gabriel was saying, he was mentioning about lobbying or advocating with the local government on housing issues. And I think we have to do that, but also do that with managed care plans, as CalAIM is moving forward to really get the state to work with us as partners to push, the managed care plans and local governments to really be partners with us on this issue of housing, and how can we bring, the funding and the resources, to individuals looking at the whole person. And that's really hard, because we got to get out of the system silo thing and look at the whole person. And, the steps in CalAIM are pretty amazing, but we really got to push that it applies to everyone. And again, thank you for, the way you've done this meeting today. And a shout out to Debbie Toth, because man, sign up for Debbie Toth's work group. Thank you.
Thank you, Marty. And those are great comments. And I think the reminder that as CalAIM rolls out, looking at how the managed care organizations are going to incorporate housing supports, understanding that housing is health and that it's the key social determinant of health, and that if we have a managed care organization making decisions about who gets housing supports and who does not, we want to really keep an eye on those in lieu of services, housing supports that are done in the best way and to make sure they're available to everyone. I see Nina has her hands up.
Unmuting myself. Hi, I'm just gonna say, just really exciting discussion today. And thank you to everybody for advocacy and your creative thinking. Definitely interested in the proposal Debbie was talking about. That was absolutely a major piece of the area to stakeholder recommendations that were not included at all in the master plan. So Debbie, can you send me whatever you have so I could share that with my colleagues?
Yes, we'll do.
Yeah, really fabulous presentation. Thank you, Debbie. I think Janie Whitford, are you trying to speak?
No.
Okay. All right. And Marty, is your hand still up for a reason? All right. I think we are. And Janie, you do have your hand raised.
I'm going to lower it for you.
Okay, I think we are all set then. I really appreciate those comments, and now I think we can open it up for public comment. And it can be on it can be both on the transportation update, but it can also be on any of the topics in community living. This is our open committee discussion time.
Thank you. We have a few comments, and I do want to remind folks that public comment is actually for comments only. If you have questions for anyone today, you can go ahead and email that engage@aging.ca.gov email address, and we'll direct your question to the appropriate department. We have one live caller. So I'm going to go ahead and ask that Nancy unmute Connie Arnold. Connie, is your line?
What? Can you hear me?
Yes.
Yes.
So you've gone over a lot of different topics today, with housing being one of the first ones and transportation the second. But with all of these things, without having care providers and backup care providers, when somebody calls in 5 minutes before they're supposed to, or an hour before they're supposed to come, for whatever reason, what are you going to do to ensure people have backup providers and services for IHSS providers and HCBS providers and those on SLS self-energized systems through the DDS? What are you doing to address that? Or are you just going to say the only option for people with disabilities is in that situation is assisted suicide because we're all employers, quote unquote, left high and dry with no care providers? And what are you doing to recruit providers, a workforce for people to actually have competent people to provide care? And
We're losing you, Connie.
Did you get that?
We got all but the very end, the very last end.
What are you doing to create a workforce of care providers for people that are going without care currently in the HSS system?
Yeah, I mean,
and how are you going to address that when people don't have a care provider that calls in last minute and says they can't come?
You know, you've identified some really important areas. I wasn't at the last DACLAC meeting, but I know it really focused on long-term services and supports, and some of the trying to build better capacity through the HCBS spending plan, the increased funding that's coming to California that will hopefully create a better infrastructure, both of emergency backup, which is so important, and also to better compensate the workforce, better train the workforce, and create some incentives to build capacity. I think that those are really important questions, and it just, sort of drives home, I think, Marty and others' points that you can't look at one piece without the other, that, the housing, the in-home supportive services, the transportation, the healthcare, it all has to be integrated, it has to be accessible, and it has to be person-centered. And I think we know we have a long way to go there. And that's, hopefully the role of this committee can be to elevate those issues that are preventing truly autonomous community living in the best possible way. And so, thank you for sort of linking it back to the home and community-based service question. It's important.
Thank you, Patty. This is Kim Johnson from CDSS. I just also wanted to lift up both Claire's comments in the chat and thank Connie for her raising her issues. And we're glad to continue to update this committee and others on that work and effort. So appreciate the comments.
Thank you, Kim. Thank you. And there is also, I think the Engage website is also a place to submit comments as well. And let's see, I think we have, the Marty's just saying that Maggie Dowling and Joan Lee would love the focus on housing and transportation and long-term services and supports and the approach of the whole person that is person-centered and linked to person-centered outcomes. So I think we have a quorum on that. So that's great. Well, I want to thank you all for staying so engaged and raising up really important issues as we look at housing, not in isolation, but as a way to support older adults and people with disabilities at all stages of their lives, and make sure that we really address the the housing precarity that so many people face due to the unaffordability of housing and the lack of accessible housing. We are making great strides in producing housing, and yet we have a backlog of insufficient housing production that we're trying to overcome. And I think as we move forward on creating lots of new housing and lots of different options for housing, your input and your lens is so important. I've learned a lot this first meeting of mine, and I appreciate all the really smart and passionate committed comments that we've received. And I think at this point, I'm going to turn it over to Susan and let her close out our meeting.
Thank you, Patty. Thank you very much. Eric, did you have any closing thoughts that you wanted to share before I wrap us up?
Yeah, I'll be relatively quick. So I just want to thank everyone who first attended and thank both Susan and Patty for this being your guys' first meeting. I think that this went very smoothly, and I appreciate your work in terms of preparation and putting the agenda together. And of course, everyone who participated. And earlier in the, and there's two things that I want to mention. One, that I hope that we can all stay engaged. I know that there are other advocates who aren't on these calls who will stay engaged during the budget process and policy process throughout the year as we move past the holidays and kind of into January next year, getting ready for the governor's budget and making sure that the disability and aging perspective is heard by those who are making some of these decisions. So I'm looking forward to that part of it. The other thing that I wanted to just quickly mention, I know it was said in the chat earlier by Marty, and I wanted to kind of second what he was saying. He gave a shout out to two people who recently passed away, two advocates in the disability community who I'm sure many of us have worked very closely with over the years. They've done so much for the disability community, for the aging community. And Eric Gelber and Marilyn Golden, two individuals who for decades have put in so much effort and time to make sure that the disability voices were heard in policy and budget and all of these systems. So I just wanted to make sure that I lifted up both of them and give kind of them a shout out as we close out our meeting. So thank you all, and I'll hand it back over to Susan.
Thank you, Eric. So I first want to thank Eric and Patty. You know, they did an outstanding job facilitating today and also presenting, but they also spend a lot of time between meetings constructing the agenda, identifying speakers, and it's to their credit that that today was such an excellent and informative meeting. So thank you both for creating this agenda today and all of your prep work and follow-up. You'll have follow-up too. I want to thank all of our presenters, Darcy, Allie, Melinda, Claire, Patty, Sharon, Megan, and Alexis, and to the 6 directors who joined us through the bitter end, who are still on the call. Thank you very much for being with us. And to our 2 interpreters, Jesse and Carol, thank you for being here today. And our closed captioner, Amanda, who's been troubleshooting. We had some technical difficulties that I hope were invisible to all of you. Maria has been locked out. Maria, who usually runs the show, was locked out. So Amanda stepped in. Thank you, Amanda and Nancy. You know, it's tough to follow in Kim McCoy-Wade's shoes. And I'm thinking of, you know, something she always said, it's iterative, it's iterative, it's iterative, we're iterating. And I heard loud and clear today that there's a strong interest in a housing work group. So we continue to iterate. Debbie's formed a transportation work group. That was our last iteration, and it was great to hear from Debbie that that's in progress and underway now. So we will talk about what next steps might look like for a housing work group. And we have in the chat everyone who has volunteered. So we have your names to follow up. And in closing, I just wish you all a wonderful holiday season. And I know how hard everyone here works and has been working for months and years on end. So I hope everyone has some R&R and some renewal time in the months ahead before we meet up again. So thank you all for joining, your comments and your participation today.